Welcome to Health Hacks.
I'm here with Dr. Paulvin, who is a longevity medicine specialist. Welcome.
Thanks for having me.
Yes, thank you for coming in person. It's always such a pleasure. So today I want to speak about your specialties. What are you offering here in New York City to your patients in terms of peptide therapy, Ozempic? What is your opinion, and who do you recommend it to?
All those things I offer to my patients here. I treat patients throughout the world. I'm in person or over telemedicine, which is great because everybody gets exposed to the newest thing to help themselves be healthy. As you know, everybody's trying to maximize them, boost their health now, which is great. They're taking it into their own hands. I offer all the things that you discussed. We're going to go throughout the podcast talking about them. Offer peptide therapy. We can talk about bioregular peptides, which are the baby brothers of peptides, which are we're around 50 years, but now become the new thing. I'm sure we're going to do a deep dive into all the new weight loss meds like Ozempic, Mounjaro, Zepbound, what the differences are, what the risks are, what the benefits are, and who should be taking them, and it'll be a fun experience.
Who would you recommend those therapies at? You said basically everybody, or do you think some group, or like if you're younger and you're completely healthy, feel like stay out of it, try it more natural, or...
What I recommend to my patients is these meds are either both Ozempic or the peptides. They are in most cases add-ons to what you're normally doing. So they're not going to replace if you're not eating well, if you're not sleeping well, if you don't exercise at all. They're going to help a little bit, but they're not going to outdo the bad stuff. So they're definitely the second part of your wellness protocol. And more the peptides, I would say that. In terms of things like Ozempic or Mounjaro, if you at least are trying to exercise and have healthy diet, and just things are not moving for you the way that you want to, then those medicines will fit right in. Patients are now, we're finding, are called either weight loss resistant, meaning that they're doing the right thing, but for some reason there's some type of roadblock. It could be that they just can't get their insulin to work the way it should. There may be a gut issue. We're finding now more and more, especially people who live in major cities, but all over, they may be exposed to some sort of toxin. We've heard every news article now about people who are exposed to plastics, microplastics, which can affect your hormones, and they make you what are called endocrine disruptors, where it actually disrupt your endocrine system and will cause side effects, including weight gain. Women can have polycystic ovarian syndrome, and they can't lose weight no matter what they're doing unless we fix those problems first, where Ozempic and Mounjaro can help that. So Ozempic and Mounjaro have a good fit as long as they're discussing whoever the healthcare provider is. In terms of helping people be healthy. Peptides are more of a nice add-on once people have started from the baseline.
So let's dive right into it. In terms of like the Ozempic and all these weight loss drugs, my approach is always like try the natural way as much as possible. But if things are not working, as you just said, like in certain conditions, Ozempic can do wonders. And I think also like being overweight, extremely overweight, is much more unhealthier than taking some add-ons that will help you to lose weight and get back into your wellness routine and get fit. So is there like, what would you recommend your patients in general, like when to start? Is there any risks that could appear? Is there that you would lose? Do you need to exercise a lot while taking it? Because you're obviously losing weight, but you're also losing muscles. Is that correct?
Almost everything you said, pretty much everything you said, yeah, there's a lot of questions. Let me try to break it down as simply as possible.
Shooting right at you.
There we go. Boom, boom. Yeah, right away. We're going right into it, which is great. So I'm going to group all the meds together initially, like Ozempic, Mounjaro, Zepbound. They work a little bit differently, which I'm sure we'll get into.
I think it would be actually very interesting to hear the difference between all of them, like how they work.
Sure.
Yeah.
So first difference is there is an oral Ozempic. Doesn't work that well. The only people who really use that right now are people who are scared of needles. And I have about 1% of my population who just will never look at a needle and inject themselves, or even have me inject them. Okay.
Here, I might be one of them.
Oh, sound the opposite. I was always the test subject for all my classes. So, so that's where that comes in. It's about a third. It works a third as effectively as the injectables. Then we have Ozempic, where in terms of, it was kind of the first one on the market, that and Wegovy. I recommend to my patients pretty much again, as long as they've either have tried to lose weight, or unfortunately if they just have a way overweight, these meds have been able to help patients lose anywhere 6-8. I've had patients lose 18 pounds in 1 month. And as you said, there's so much of a health risk to patients who are morbidly obese or very overweight in terms of heart disease, cholesterol, risk of Alzheimer's, infertility, the list goes on and on and on.
Yeah.
So we want to implement those programs as soon as possible. I always do discuss the risk. Again, it's something you definitely want to discuss. Your doctor, everybody has their own individual health conditions or risks to it. Luckily in the last 2 or 3 months, literally every day is a new study coming out about these meds, either good or bad. In this case, there's been a lot of more good than the bad recently. But we do risk there is on the label a risk of one type of thyroid cancer. We really get concerned if they have anybody who's starting to take them have a family history of thyroid cancer, even though some just came out like last week that's showing that patients that are on these medications actually have a decreased risk of 10 separate cancers, including thyroid cancer. So it's still there, it's still a concern. The other thing, like you mentioned specifically, we do worry that patients who are losing weight, and especially on the either side of the extremes here. We have a lot of patients who are very petite, who are trying to lose that last 4 or 5 pounds, or the patient who's trying to lose like 100 pounds. We want to make sure that they're preserving muscle mass as much as they can. That means they should be doing weight workouts, optimally 90 minutes a week. They should be trying to maximize taking creatine to maximize their workout. My patients, because it's a very specialized kind of, we do a pretty intense program. We actually have them do what's called the DEXA scan, where we can look at their muscle mass, making sure that they're not losing too much muscle, and what their fat is. So if they just have no fat left to lose, and they're just mostly either all muscle or very petite, then we say, okay, we got to take you off the medication. So that's what we're looking at. And then the main risk more with Ozempic is going to be hair loss, explosive diarrhea. Now that we know dosing better, doesn't happen as much. So you get a lot more gastrointestinal symptoms with Ozempic than you do with Mounjaro usually. And then
that is the way how it works.
It's working on the gut, slowing your emptying. It does affect the gastrointestinal microbiome as well. And we just see a lot more bloating and diarrhea with patients on Ozempic. Mounjaro, which is kind of the big brother, really we just see a little bit of bloating. And that tends to happen more in patients who don't understand how much they should be eating, because obviously it decreases your appetite, slows how quickly your stomach is going to empty, and they just eat normal meals which they shouldn't be. So that's more how they're using the medication. But so there's definitely risks to the medications. You want to understand that before you undertake them. These are things that I tell my patients, it's not something you can just do for a month and you're done. Usually you're going to want to build up for a month or two, because you're going to titrate that dose higher and higher usually on both medications, and then you're going to probably want to wean yourself off the medication for a month. So you have to understand you're probably going to be on the medication at least 4 months, 3 to 4 months, if not a longer period of time. It's not something you can just do 1 month. I'm good, I'm going to stop at cold turkey and I'm great to go. So there's definitely, it's not like a 5-day course and you're done.
Yeah, it's not like a quick diet and here you go. It's like something you really need to adjust your body into it and then take it off slowly.
Exactly.
But could it be that, for example, obese patient would take it and after they slow it down again, they fall back into their original weight?
We're finding, there are patients who, especially in the obese category, that will regain the weight because they don't have the first part, which against the lifestyle changes. So that is a major concern. Where I'm finding that the patients besides that category who either have addressed their hormones either through through these medications or other steps do not gain the weight back as much. They may gain a couple pounds back. I mean, this is the medicine which works really well about stopping your cravings and regulating your hormones. So this is going to get you down to a low weight, which you may not be able to maintain without the medication. So people have to understand that you may gain a pound, 2, 3, 4 pounds back, but you're still going to, in most cases, going to be less than where you started from.
So it's more also like in terms of like your mindset, changing your mindset in that period. That's also why you don't take it for like a week. You take it longer to adjust the portions, to adjust the amount you eat, when you eat. No more cravings in the middle of the night.
Hopefully, yes, yeah.
Yeah, so it's also like a mindset changing. Because that's like, I think it's so much about like what your habits are. The habits are what's a lot about like weight loss, weight gain.
No, habits are a huge part. The mindset is, we're learning more and more, is such a big deal.
Yeah.
Are you a dopamine fiend where you need to have that constant stimulation, which is why people eat at night, or eat nervously, which we're trying to avoid with these medications, but that's what we're trying to overcome. And the way I always kind of explain to in this situation is, your body you got to fill a bucket faster than it's leaking. If you're somebody who has nighttime cravings and you have poor gut health and you have inflammation, you don't work out, then you're going to probably still have a losing battle. Or if you do most of the things correctly, you're going to overcome those. And then the key is mindset, because the meds only do so much. If you don't work on your own behaviors, then it's only going to stay for so long.
Exactly. So it's changing your behaviors. That's a major key of it for the long run, so that you don't fall back into your bad habits afterwards. And why does Ozempic and all these drugs have like kind of like a bad reputation in daily life? People would not talk about it so positive.
There's about 2 or 3 major reasons. One of them, I think people are against. Initially, people felt it was just a shortcut. Like you said, people were not adopting the mindset, weren't changing their lifestyle, and people were like, just, okay, I'm gonna just do this medicine and not put the work, which is not. In most of my cases, I don't find that to be true. I have patients who have tried everything for months. It's upset them so much. Like it's freaked them out. I don't know. It's freaked them out. They just don't know what else to do. It's not, I don't want to do anything, I'm lazy, I'm gonna go to the doctor and get Mounjaro. It's not. I say 90% of my patients aren't like that, but I think people perceive it that way. People initially there were people who, like, for clickbait, were just bashing it. I've heard people online that's like the same as taking like Oxycontin and all these things that had such a horrible effect on people's health. I'm like, you're not reading what's out there. I mean, part of it, I think, was the social media thing, and I think part of it's just not understanding what it does. And now, luckily, what's kind of changing people, there's studies, like I mentioned, they're showing that some of the side effects are not as big or worrisome as we thought. Plus, we now know that these meds not just help you lose weight, but they can help patients with damaged livers. The liver will heal. We're using it for patients who have addictive behaviors, both either like OCD or who smoke or have alcohol issues. And we found that their use of alcohol or smoking will either diminish or go away completely. So there's other lifestyle benefits besides just the weight loss part, which I think has kind of made it, instead of being, it's just about people want to lose weight and look good, now is kind of a more, people understand what the power of these meds are. So I think it's changing a little bit, but I think it's the most popular thing out there right now, and people just want to bash it. I think it's just human nature in our society in 2024.
So Mounjaro and Ozempic both do the same in terms of also lowering their addictive behaviors?
We think so. Right now, the data has been done more on Ozempic, which is semaglutide, because it's been out longer. So they've had time to run the studies. I think they're going to they're going to find very similar, since there's a very similar mechanism with Mounjaro. But we now know that semaglutide is the one that can help our liver. It's been the one that's shown definitely benefits with addictive behaviors. It's also helped with sleep apnea, which is people who snore and then can gain weight that way as well. So that's the one that's been tested in most. Mounjaro did get tested for sleep apnea as well. So it's most of the time it's been semaglutide so far.
Oh, wow. And you are a fan from Mounjaro, as I loved your description before. I was like comparing those two, like the cars, saying that.
Well, right now, I mean, Mounjaro has less side effects. I mean, a study just came out that you're going to lose probably at least another 30% weight than you will with Ozempic. And also demonstrates less side effects. So they're both cars going to get you from A to B. I don't want to offend any car companies out there, but yeah, so Ozempic is kind of maybe like the Infinity, like it's definitely a nice car, but Mounjaro right now is the Ferrari. And honestly though, there's probably in the next year going to be even faster Ferraris coming out. That are now 15-20% better than Mounjaro. Yeah. They're going to help with cholesterol, and they're going to have less nausea, and there's going to be better cars coming out in the next 12 to 18 months where, I mean, really, we're going to see a lot more people on these meds because it's just the benefits keep adding up.
Yeah, it's not only about weight loss. For me, that is new, for example, that it's also helping with addictive behavior. So people who are smoking, alcohol problems, all of that, does it also help in general with any drug addictive?
They're doing some studies with drug addiction. They think it will. Again, it's kind of that part of it's going to be, like I said, that is it filling the bucket faster? Like it depends on how addicted, what they're addicted to, why are they addicted, but it's definitely going to probably be part of the routine.
Yeah, super interesting, especially changing the mindset over the long period of time. That is kind of like the goal. You might even can replace it with placebo at one point, because I think it is so much what our mind thinks what we're taking, and that might be very helpful.
Yeah, we'll see. We have to see exactly what works well. Again, like I said, we know there's study after study that shows that patients who believe something is real even though it's not, and they feel better, and it helps heal what they have. So the mind is still the strongest medicine out there.
Yeah, I find that so interesting. The mindset, how strong it is, and what you believe. And so yeah, the placebo effect, always mind-blowing. So, but your patients who would like come to you and take Ozempic would usually, how long do they usually take it?
It really depends on three things. I mean, obviously it depends on how much weight they want to lose. I would say the average right now is somewhere in the 6 to 9 month range. Is probably a fair kind of average. I mean, right now what we're seeing is, again, I have cheesy analogies with my patients, is there's 3 buckets at that point. There are patients who they're like, hey, I hit my number goal in my head, I want to stop today. And that's one bucket. And then we just say, okay, make sure you have your life goal, your lifestyle in check, and we see how things go. We have other patients who want to have like a safety blanket, and there are now, in the last 3 to 6 months, we now know of supplements and other medications that we can use with them to kind of give them that safety blanket where they're coming off the strong medicine, but they can still get some help with the weight loss, and so they don't feel like they're going cold turkey. And we have other people now who are using these meds much longer. We're doing the testing, like I mentioned before, to make sure they're not losing too much muscle mass and they have fat that's not going to hurt them, but they go on much lower doses, and that's called microdosing. That hasn't been studied as well in formal studies. That's where you're going to get a huge debate. We know that, I mean, I have patients, and a ton of other doctors have said they get a lot of benefits in their patients just in terms of their overall health, in terms of their hormone levels, their energy, how well their cognition is, their inflammation goes down. We know that based on lab work. So those are kind of the 3 buckets that we see after patients kind of want to wind down from it.
And Mounjaro, how long is it out for now? Or how long do you use it with your patients?
I mean, I use it about the same. Both are about the same. Mounjaro's stronger, like I said, so we may get to their goal maybe in 3 to 6 months. Unfortunately, it was a little more complicated because there was a huge Mounjaro shortage the last couple months before we were filming this, but now that it's back. But it's about 3 to 6 months, a little bit shorter.
Okay, yeah. And you prescribe that one instead of Ozempic?
In a vacuum, I recommend it, yes. I mean, there's always insurance and other things, and my friend took this, and I want to take this, and that's fine. But in a perfect world, I'd rather they take them. I think Mounjaro has less side effects, works better. That's what I recommend.
And what are still the side effects? People feel nauseous, and
they may feel nauseous and bloated, the main 2 side effects that they get with that medication. Again, usually we try to tell patients, again, the first couple of weeks, make sure you're eating like a smaller portion you think you're going to need, so patients can learn how much food they really need to have then, because some people just are amazed. Okay, I ate this much, I feel full, I feel good, that's what I need to take. That's not how much they ever ate before. So again, it's a learned behavior. And then we make sure they're doing is either eating high fiber foods or using things like psyllium husk, which will help them avoid the constipation and a little bit of the bloating, because their things will pass through a little bit easier.
Yeah, I see. And I think in overall, those weight loss drugs are very efficient and very effective on people who are obese to get back to their routine in terms of longevity and health, because it's much more, I say, dangerous and unhealthy to be obese. People, you would say everybody who is struggling with weight should actually take it, as long as they live healthy, because the number one is your behavior.
I think that most patients should definitely consider using these medications, especially as we find some of the other uses for them. I think they have a lot of benefits, but I understand, like you said, it's still the mindset and the lifestyle is by far the most important thing.
Yeah, so exercising, having a healthy diet. Like you can't take Ozempic eating ice cream. It won't do the job.
Everything within moderation. Yeah, it's the 80-20 method, but yeah, in most cases, if you're eating ice cream every day, it's just not going to work. No.
Especially because you only take it over a certain amount of time, and then you get back to your normal routine. So you should more change the goal of these drugs are more changing the mindset and the behaviors. Is that right?
It's both. It definitely helps because it works on the brain. We know that it works in the hypothalamus and in specific areas of the brain to make you feel full and help change your appetite patterns. But it also is going to lower it's going to help make you less insulin resistant. I mean, your insulin is going to work better, which has a lot of benefits in terms of muscle building, energy, brain function. It also may help with your male or female hormones, in testosterone or estrogen and progesterone. I mean, men and women have testosterone, but it's a whole other conversation. So it does, and it may help replenish the microbiome, which is the bacteria in your gut, which is important in almost every positive or illness now that's out there. So, and also decrease inflammation, which helps your mitochondria. Again, problems with your mitochondria will affect all your a lot of the medical issues that we see out there now. So it's both. That's what's great about these meds. It's working on the behavior part, but it's also fixing the biology, which is that's why it's kind of the perfect storm right now.
And it's also helping with fertility if it enhances the testosterone, because we women have testosterone, as you said, we get it during our ovulation. So exactly.
They're now calling them like Ozempic Mounjaro babies, and we're using it like for polycystic ovarian syndrome and some other issues that have inhibited women from getting pregnant. So it's definitely it could be a big deal in that regard as well.
So in terms of like when you take it and your body is, for example, it gets more insulin sensitive, would it be any chance that if you take it over a too long period of time and you get off the medication, that your body is not producing enough insulin because of the substance that is missing?
Very, very, very unlikely, because it's making, they think it helps your pancreas work better to make insulin. So unless you're taking, I mean, it's not even been proven, but taking really, really high doses for such a long period of time, but it's very unlikely.
Okay, so the dosage would be too low in order to have that effect.
Yeah, it doesn't work that way usually.
Okay. And in terms of longevity, you also do peptide therapy. That is something I'm also very curious about to hear. Who do you recommend that to? And of course, it depends also in what kind of peptide therapies do you have?
Yeah, so peptide therapy could be used by everybody out there because it's such a huge bucket of things that it helps with. Like I explained to patients, there's about 6 different areas or buckets that it works on. It's great for the vanity things like hair and skin complexion and weight loss. We can use them for muscle building and working out in the gym and recovery. That's what people may have heard of, called the Wolverine stack, which is probably the most popular peptides that are out there. We use it for gut health. We use it for either to optimize your brain for patients who just want to be an 11 out of 10, or patients, unfortunately, who have a brain issue. And then there's kind of like the miscellaneous peptide bucket, which is kind of just other things that we can use it for. We can use it for nerve issues. We can use it for what else? To boosting and regulating your immune system. There's just there's one for almost everything. In some cases, they're going to be your primary treatment, and in some cases, they're nice add-ons. But they're very helpful. I mean, the main thing people need to understand is most of them are injections. Probably at least 60 to 70% of them are injectable as their strongest form. Some people don't want injections, so we have to switch to pill or nose spray or creams. But that's also the great part, is that they are available in so many different forms.
Which kind of peptide therapy do you offer?
I mean, I pretty much offer almost all of them. I mean, there's not one I don't. And like I mentioned in the beginning, there's also now what's called peptide bioregulators, which are much more narrow, where they work on the genes of a specific organ. Like there's one for stomach and one for pancreas and one for your cartilage. So, I mean, I run the gamut. There's probably 70 or 80 of them.
Yeah, and for everything there's something, right?
And they all kind of play really well in the sandbox together. So we take something from column A, column B, and then, you're taking collagen peptide, or you're taking out of fatty 15 or something else, and we can just mix and match to make it to work to maximize your stack or your combination of supplements.
And so that is something that you take once, or is that something you need to do regularly? And
there's 2 sides. So, well, actually 3. There are patients who, I kind of explain to patients, it's kind of like a Motrin. If you have back pain and you have a chronic back issue, you have a back issue for a month, you take your Motrin for a month and do your physical therapy, and then you don't take it again until you need it again. There's other people who are doing it to maximize their performance, be it brain or muscle or whatever it is. In most cases, they're doing it for 2 to 3 months. We call it a cycle. And then we'll have them stop because your body will become used to it and you're not going to get as many benefits from it. So we have them do 3 or 4 months. The last kind of part of that would be people who do it for anti-aging, but do an anti-aging combination. Usually they're going to do that once or twice a year for 10 to 20 days. So there's really 3 different versions. It depends on what you're using them for.
And is that something everybody should do in order to enhance their health and longevity?
Everybody doesn't have to do it. It's something that's a great add-on for a lot of different things. There are a lot of benefits to it. But it's something you have to be on board with because, it's not something that you just do for 2 or 3 days. If you're going to be on a site, you're at least doing something for 3 or 4 weeks, and they're not inexpensive. So you have to be committed to it, both the cost and injecting yourself and getting them delivered and making sure you know which one is which. So it's a process of people either are in it or they just maybe will take a pill for like a month and they'll just dip their toe in. Yeah. But if you have great exercise and great sleep and your diet's on point, you're 90% of the way there. This is the extra 10-15%. This is the icing on the cake.
But it also could, if you do peptide therapy in terms of hair loss, could that reverse any damage and grow back, for example, the hair? And
peptides, that's one of the situations where peptides are a great add-on. They're not this new wonder drug where it's going to be, oh my God, I took the 2 hair peptides, which are I can't ever say it, zinc thymulin or thymosin beta 4 or PTD DBM, and my hairs grew back and I have a big hair. No, but people are doing that with red light therapy, or they're taking a hair supplement, or they're doing exosome injections, which are a whole other different treatment. So they're adding it in with other things. It's just because honestly, partially because it's a lower price point than some of the more expensive procedures that are out there.
Is there any chance that your body wouldn't, if you inject it, that your body doesn't take it on? Your body rejects it and doesn't, it's just...
You can definitely be sensitive or allergic to certain things. If you have some type of either gut issue or detox issue, or what we call a mast cell issue, which is your body produces your body's histamine, and the people become very sensitive. Things with the people who say, I take any medicine and I get a rash or I get a side effect. They may not do well with most peptides, or you have to. What I'll tend to do is do them very low dose and maybe have them do it 2 or 3 times a week rather than daily, and you do baby steps with them. They may not react as well.
And in terms of your immune system boosting with peptide, you would kind of inject T cells. Is that?
They work on these are in working on your thymus specifically, which helps your body produce certain immune cells like the T cells that will help with there. In addition, you're also decreasing inflammation, which is going to help your immune system. And again, we're seeing overlapping themes. You work on your mitochondria, which is going to help your immune system. Oxidative stress, which is part of your detox pathway. So you're doing multiple things to work on your immune system. The primary way is to boost your thymus production. But we can't now. And then you can combine it with stem cell treatments, or if you're out of the United States, CAR T treatments. So there's all these new treatments that are coming down the pike. There's a there is a bioregulator. There's pineolon and thymulin, which can be used to help regulate the immune system. There's different combinations. Depends how deep down the rabbit hole you want to go. People who are maybe familiar with Brian Johnson, who's spending literally $500,000 on this stuff, doesn't mean 99% of the population is going to do it.
Yes, of course. And so, if you're having your, if you're here in the United States and you're getting a peptide therapy, that is basically what you could do for your longevity in order to boost it more. Stem cell therapy is not allowed here yet.
Right.
And so this is kind of the little sister of stem cell therapy.
Yes, exactly.
So that is basically what every US citizen can do here, because that's been proven to be allowed. And I guess in the future we will have stem cell therapy coming here as well, or? We
have no idea at this point. That's a whole, if we knew the answer to that, I would also like the lottery numbers. A lot of my patients, well, again, are doing it other places, but right in the US, we are not allowed to do any type of stem cell or manipulation of our cells at all. It's against the law.
So stem cell is much stronger than peptide therapy.
Yes, it's stronger, but the way I'm choosing now, it's not as controllable because you're getting an IV. So unless you're doing it for inflammation, like a muscle tear or something, it's kind of just getting an IV or an injection, and you don't know exactly. You know it's going to help, but you're not sure what it's going to help. If I'm doing BPC or I know it's going to help my inflammation, it's going to help heal the gut. It's much more focused. Peptides are not as strong, but they're much more controllable. We know what we're using them for. Like I said, like BPC is for the gut, or we're using KPV for the gut, or we're using stribulizin for the brain. A to B, we know what's going to happen, and we know our result. If somebody's getting some type of stem cell infusion, we're hoping to boost your immune system and heal things. But if I did it and you did it and your friend did it, we'd all get different results. If we all did BPC, we would probably get more overlapping results. So it's stronger but less controllable. It's like a 17-year-old driving a Ferrari. Very powerful. You don't know where it's going to go.
Yeah. That is if your body takes up on the stem cells.
Exactly.
Because there are also cases that your body would not, that your body doesn't take them on, and so then it's also not really working. I think that's just, we haven't studied it as much as the peptide yet, where the peptides are very direct, and we know the results that are coming out. Mm-hmm. So that is something, if somebody has a problem in a specific area, you can get a peptide therapy on exactly that area to boost your health there, or with the hair, with skin, with basically everything. But if in terms of longevity, if you wanted to increase all of that, you could take all of the peptides possible, or is that unhealthy?
No, you don't want to be taking all the peptides at the same time. Usually, the most I have any patient taking of peptides is 6 or 7 at one time, and those are usually patients who are either doing a longevity stack, which is, like I said, about a month or so, or they are taking like 2 or 3 for an injury or an illness, and they're taking like 2 or 3 for kind of like for the hair or for their skin. And some of them are either a spray or a cream, so it's not like you're having to inject yourself doing 7 injections a day, because almost nobody's going to do that. So that's probably the top I have of anybody doing it any one period of time. Just beyond that, if you have a side effect, you don't know what it is, and if you're getting benefit, you're not sure what it is. So I say that's a happy place right there.
So when you're doing peptides, you can do it for injuries, you can do it for any kind of things, but also for weight loss, which would be our hunger hormone lowering ghrelin. Is that also something you offer to your patients, or would that, because we spoke about the weight loss drugs before, Ozempic and Mounjaro, which one would you recommend?
It's a combination of both, in the sense that, yes, it was kind of one of the original weight loss things that we were using before these Ozempic and Mounjaro kind of came out. Now, because those meds have more side effects, you get what they call hangry. You get hungry, a little moody potentially, especially females. I don't use them as much. We use them still for patients who want to build muscle or get lean muscle mass, but they're going to do it lower doses for a shorter period of time. So that they work in that respect really well. But we don't use them very rarely. Will I use them for weight? The only reason I do is, again, same kind of thing I keep going back. If somebody doesn't want to do an injection, they do help you lose 2-3 pounds a month at max. So that it's not amazing, but it gives you some benefit to them. But it can make you feel a little bloated. It can make you feel hangry. So a lot of patients don't use them as much anymore, but they definitely have their benefits. Also helps with your skin. It may help with your deep sleep. So it definitely helps different aspects, both acutely and also your things you want to use for your health span and increase longevity.
So you would recommend just like the Ozempic and Mounjaro for weight loss because it's just so much more effective?
Yes, exactly.
And the other one is more like, it is a peptide that is out there, but it has been used more before these drugs were coming out. So now all the peptide therapies are more like a kind of like a way of like doing stem cell therapy in a more direct, safer way, but not as effective as stem cells.
I mean, the only time that the conversation really comes up between peptides and stem cells in the same conversation is going to be in terms of somebody who has an injury. So a lot of patients are going to start doing peptides first, like I said, mentioned the Wolverine stock, which is usually BPC, TB4, thymosin beta-4, TB500, and then a growth hormone peptide, which is, people may have heard of CJC or tesamorelin or sermorelin. That they're going to start with, and if that does not work for them, then they may proceed into something like a stem cell procedure, or patients who are in a longevity mode and they just want to go for the home run and try something strong. That's where we kind of compare the peptides and the stem cells in the same conversation. Otherwise, they're kind of two distinct therapies. Like, we're not going to talk about doing patients who have leaky gut or bloating. We're not going to use stem cell for that. We're going to use BPC and lorozatide for that. So there's some overlap and some where they're distinct.
So in general, if you do the peptide therapy for growth hormone, for building the muscle mass, could there be any danger because a growth hormone eventually grows anything? What about cancer? Because it could grow cancer cells.
Yes, so that's kind of been the holy grail of bad stuff for peptides. There's no definitive data yet, but yes, it's assumed that if you do raise things that affect growth hormone, you can increase your risk of cancer. That is why I mentioned before, we tend to do things for 3, maybe 4 months, and then we have the patient stop for that same period of time to limit that risk. If it does happen, we are screening patients ahead of time. If they do have a history of cancer, we don't put them on the growth hormone peptides. It's just too big of a risk for them. But so if the patients are aware of that going in, it's like a lot of other things. You go on the lowest dose possible to achieve their effects. We're monitoring them, and we do, again, make them aware of any side effects. We are aware now that a lot of the growth hormone peptides they're improving receptors. So they're not automatically, patients aren't going to have their growth hormone levels automatically shoot through the roof. So that's actually a good thing in a lot of ways, because that's where you really can get yourself into trouble if you're boosting your growth hormone levels over a longer period of time. But so patients there are post-surgery are doing true growth hormone after surgery. That's become much more of a thing now. But that's not a peptide. It's actually, we can get from the pharmacy growth hormone, and they'll either inject it in the site or they'll do it not like a sub-Q injection.
So in general, you would recommend people to take who are taking growth hormone or the peptides for it, the therapy, to do cancer scanning before?
I don't. We go through their family history, and then we check their levels before. So I don't have everybody do that. If they do have some type of close family history, then they do some type of cancer screening. Yes, but it's not 100%. But at least it gives us some idea where things stand.
Yeah, I mean, that would be kind of like crazy bad if you would take growth hormones and you're having a cancer inside you that kind of like would explode the entire thing. Yeah,
I'm much more cautious than a lot of the people online in terms of people recommend them just take it in perpetuity, and then patients come to me and they said, I saw online I could take them forever. I'm like, no, you really shouldn't be. There's too many side effects that I don't recommend it. And that's the biggest risk.
And most of your patients come when they do the peptide therapy. Which kind of peptide therapy is like the most common one to get?
The most common ones now are for healing, which I mentioned before, the Wolverines, at least BPC, TB4, potentially one of the growth hormone peptides. And the other one now is probably gut healing at this point. And then the longevity stack is probably third.
For gut healing, what kind of peptide would that be?
That's at least BPC, usually now BPC and lorozatide, because lorozatide is really good at healing the gut lining, which made people who are probably listening have heard of leaky gut, where a toxin or an infection can damage the lining of the gut, which increases your increased risk of immune issues, illness, brain fog, things like that, because the connection through the blood vessels and now the vagus nerve, which is the nerve from the brain to the gut. So it helps kind of glue it back shut together, heal it and glue it together again. So those are where I start. And there's a couple other ones that we can add in there. If it's an immune issue, thymosin alpha-1 or thymulin. We can add in KPV, which is also good if in a mold patient or a toxin patient. So it's a nice little recipe, but those are the two that we start with.
I see. Yeah, the vagus nerve is something that is interfering a lot with our, let's say, with our health and our, in general, with our brain and our entire immune system and our gut. So if the vagus nerve is not calm, we're having a lot of problems. So that is very great. So you can calm it down with that peptide therapy.
Yeah, because if the infection is diminished, the inflammation is diminished, and your immune system is improving, which all things we can do by healing the gut, then the vagus nerve will have better health.
I see. And in general, like a lot of people are speaking about the NAD plus supplement, or is there also an injection? I don't know.
There's everything now. So you can do everything from NAD skin creams, which have some proven benefits to it because they help with getting rid of senescent or zombie cells, which are cells that are kind of dead but not gone. They also decrease inflammation, so we see them in skin cream. You can do a nose spray, which most patients are doing it for brain boosting. There is a pill. I don't love the older pills. I don't like at all. They really don't work that well for most patients. There's a new pill that just came out in the last year, which has much more demonstrated benefits in studies. There's a self-injection. I have a lot of my patients now who do a self-injection like 2 or 3 times a week, and they will have more energy. They'll have less brain fog. Their workouts may be better. And then there's the IV that everybody's aware of. The ironic part of that is the IVs really don't have many great studies showing that it does anything. But the only ones that are out there, the patients in terms of proving mood, like OCD or bipolar. There's some smaller studies that show that, but those allows us to do much higher dose of NAD. But it also takes about 3 to 4 hours. It may burn. You can get flushing. So a lot of my patients have switched to the self-injection versus doing the IV, but it does have a lot of benefits. And there's a new one that's kind of come back to favor called 5-amino-1-MQ, which is an inhibitor of part of the process, which also has benefits. So there's a lot. Right now, it's either do 5-amino-1-MQ with some other supplements, or do the injections, or something called 1-MNA. Those are the 3 versions that have the most studies right now. This time next year, there'll probably be 2 other things that are going to come out. They're going to be really exciting, but actually, I can't mention them yet.
Okay, I'm curious about
There's one thing coming out that has a lot of potential, but they don't want people really talking about it yet.
Yeah, I see. Well, curious. And
Pique the interest for next year. There we go. Good job.
Of course, for the next year podcast, there will come out and be a discussion. But yeah, so the NAD plus, just for people to make it more understanding, is basically very important for our mitochondrial function. It is boosting our mitochondrial function, which is again the power of our cells.
Yeah, it works on different reactions in certain parts of our electron transport chain, which the electrons, and it produces ATP, which is the power pellets or the electricity to make our body work. The more ATP you have, the more energy you're going to have, and every cell of your body needs that. And it does help your mitochondria, which is the battery of your body, work, and the battery of your cell work better. So it's part of that. There's like 6 or 7 things that we normally will use for patients to optimize their mitochondria, plus doing things like red light therapy are really beneficial for that as well. And we know mitochondrial health is great for just energy and brain function, and we're using it like I use it for Alzheimer's and concussion. It's great. It's great for everything. It's great for everything to work on your mitochondria.
If you get the more healthier mitochondria the better, the longer, stronger you will live. That's for sure.
Exactly.
And it's going to boost basically all over your entire body. Every cell will get more healthy with the NAD supplement if it works well, right?
Exactly.
Is there any chance that you would take NAD supplement and it doesn't make any effects?
The supplement, yes, definitely.
And so if you with the supplements, yes, but if you if it's the supplements, it basically gets digested. Does it even get into your body?
Well, that's part of the debate right now. Is depending who you're talking to online and the experts. That some only, and we know one form called nicotinamide riboside is the one that gets into the cell. So that's the one that we know works well, and that's the form that hopefully will be coming out in IV form soon. That would be much more beneficial for patients in IV. Yeah. And now the other form that I mentioned, 1-MNA, also can do function in the cell. So that's our goal. But a lot of the other ones don't get in. A lot of patients will do anything from the self-injection, the pills, the nose spray, and they say, I spent X amount of money and I don't notice any difference.
Yeah, because the body didn't receive it in the correct way.
They couldn't absorb it, or like a lot of these things, the same thing with taking any supplement. If your gas tank is, if you're 95% full of B12, you have enough that you don't need any more. Adding more doesn't doesn't do anything.
Yeah, I see.
It's not like you can maximize even more.
But what would you recommend the normal person, I would say, to go if they want to enhance their cell function, their mitochondrial function with the NAD plus? Or what would be your go-to if it's not NAD plus?
Two-part answer. I would say, again, I would recommend either do the NAD injections or right now using the 1-MNA supplement, or you can try the nucleotide, they're called NR supplements. Those have the most potential for benefit. But if you're trying to boost your mitochondria, my go-tos are CoQ10, urolithin A, alpha lipoic acid, are all things that your mitochondria needs to help it work better. And those are things that we are going to almost always give you some bang for the buck, as opposed to some of the other things that are out there.
And those are all being injected?
No, you could do an injection or a pill of all those things.
Pill
or
work
IV.
good well. Oh, interesting. Okay. And those are things, if you take it in form of a pill, you could just basically get it at the pharmacy, or do you need a prescription for it?
No, I'm thinking all those are supplements, so you can get them online.
You can get them. I see. Interesting. But is that would that be like a really lower step of stem cell therapy? Because stem cell does also enhance your cell function, and of course,
a lot of places are using those before patients do stem cell therapy, but they're not going to approach the potential benefits of stem cell therapy.
Yeah, stem cell therapy is again the Ferrari.
Yeah, the Ferrari. I mean, the one that even has a lot of great benefits. Some called the one I mentioned is urolithin A, which is from one company called Timeline Nutrition, and they have studies all over the place with different building muscle, helping your immune system recover, helps leaky gut, may help Alzheimer's and brain prevention. They're the ones who probably is going to give you gives you the most bang for the buck of any supplement out there. So that's the one that has the biggest bang.
The strongest that would be recommended for people to take.
Yeah.
Super interesting. Yeah. Yeah. So all of these things kind of enhance definitely our longevity, and those are all the things that you can do safely. And we're waiting for stem cell therapy to be more proven to be effective and more safe also. To come to the US, I guess. And until then, those are all the things that are the most effective things that you can do for your longevity. And yeah, thank you for being here. I think we hit all of our topics today, and it was super interesting. And thank you for describing everything so much in detail.
Oh, it was great. Thanks for having me. It was fun.
Thank you for listening to Health Hacks. I hope today's episode gave you more knowledge to improve your health.